All right, good evening, everyone. Welcome back to the Two Druggists podcast. It's myself, Dr. Matt, and the esteemed Dr. Ben. We have no hate mail this week, so we're going to get right into our show, and we're going to talk about diuretics. So without further ado, we'll get right into it.
Yeah, appreciate it, Matt. So you mentioned we didn't get any hate mail. Did we get any
No.
fan mail this time?
No fan mail. However, we have over 100 views on YouTube for each video, so that's positive.
I think we're like 120. We shouldn't sell ourselves short, right?
120 and 127. You're right. We should not sell ourselves short.
Joe Rogan, if you're listening, we're out there. We'd be happy to be on the JRE.
That's right. We will spice up the Joe Rogan experience.
Yeah. What are we covering today?
Well, let's see. We did ACEs and ARBs, so we should continue our jaunt through the diuretics or blood pressure into diuretics, I think.
Right. So there's a bunch of diuretics.
There are.
When people call in and they're like, I need my water pill refilled.
God, I love that question.
There's various ones that might need to be refilled, right? Because you can be on multiple.
That's right. I need my white water pill refilled.
Right. my teeny tiny one.
Yeah, but the last time they changed it to the orange one, so I'm confused.
Yeah. Shortages are an issue these days.
They are. All the generics are made overseas. It's terrible. So yeah, there are a bunch of diuretics. I bet the best water pill, although probably not the one with the most clinical evidence, is hydrochlorothiazide. Yeah,
the thiazides, they're a good one. They're like a first line in some people, I think, for hypertension. Get them on a thiazide, see what happens.
That's microzide for all you people that know brand names out there.
What's that one? HCTZ? Is that the one?
Microzide. Okay. So here's, do you remember which JNC version we had in pharmacy school? Because I think they've updated it.
When we were in school, I think it was 7, but now we're up to 8.
We are up to 8, yes.
And I don't know a whole lot about it. I guess the bottom line is it's less aggressive, just in fears of the elderly people falling over. We're happy at the 140/90 sort of deal instead of aggressively pushing, similar to the diabetic agents and the blood sugar.
Right, exactly. We're going to have to pause the recording. We may actually have a pharmacy student that wants to come on.
Oh, really?
Yeah.
Okay.
Diuretics. Come on, Matt, you can spell. Actually, no, I really can't. Hopefully
we can grill them on the nephron.
Oh, I remember the nephron. That's encapsulated.
I don't.
Oh, come on. I love the nephron. You've got the glomerulus and the ascending loop and the loop of Henle and the descending loop into the ureter.
You got the old Bowman's capsule. I'm looking at a picture of it right now.
Yeah. Think about it. What if you were the guy that had to sit there and, try to figure that shit out? Oh, she's online. I shall admit the pharmacy student.
Okay.
We'll see how this goes.
Yeah, let's get her on.
Hi, Randy. Welcome to the Two Druggists podcast. You're here with Ben and Matt.
Okay, I swiped over and now I see 3 screens. Hey, Randy, if you can hear me.
Let's see. She's not muted. Now she's muted. Randy, can you hear us?
Looks like something's going on.
Well, she's trying. So as that happens, we'll bring her in. And,
So there's the HCTZ and there's also the chlorthalidone, which a lot of people forget about, I think.
It's funny because chlorthalidone is supposed to have the better clinical evidence with it.
I remember when we were in school, I saw something about that.
The brand name for that one, do you remember what that is? Because they didn't teach that.
I believe it's Diuril.
That's chlorthiazide.
Okay, so maybe it's, what is chlorthalidone?
It's hygroton, Hygroton.
Okay.
Never heard of that brand name.
That's a real old one, though.
It is. That's another one probably from the late 70s, early 80s.
That old?
I think so. But go ahead, Ben.
Well, one warning that I can think of off the top of my head with thiazides, and I don't know that it's something that's totally that serious. It's more of like a cautionary statement.
Yeah.
Sulfa allergies. So
yes.
It's an unlikely type of cross reaction you'd have if you have a true sulfa hypersensitivity, but something to kind of look out for, monitor if you're starting on a thiazide. They've got that sulfa group somewhere within the chemical.
Most of them do. And that does cause problems. And you and I both know there are people that are highly allergic to sulfa. And that's an issue.
It's not something you want to play around with, but
no, decidedly not. So mechanistically, the thiazide diuretics work in the kidney, of course.
Mm-hmm.
And as I recall, they work in the ascending or the descending loop to block sodium reabsorption, right?
The distal convoluted is what my Bible says here.
Oh, that's right. I have the Bible. You and I have the same Bible.
They get rid of the sodium in the water.
Is yours the King James version or the New Revised?
Mine's the New Revised, so it's the top. It's the top notch of the top notch.
Excellent.
Everything that I'm saying and reading out of this is 100% accurate and true. Hey, there she is.
There she is. Welcome.
Welcome, Randy. Thanks for joining us.
Still can't hear her.
Well, we had the same technical difficulty. That's why I'm on the earbuds.
Is your mic? Oh, wait, I heard something.
I think, there she is.
Okay.
Welcome.
Hi.
Welcome. How are you?
I'm good. How are you?
Doing good.
So everybody on the podcast, this is a live recording that's going to get edited. So if you say any swear words, don't worry, okay? This is R-rated.
Okay.
We'll splice them out.
Yeah.
I mean, we were just talking about the Bible, so I would hope we will.
Yeah.
Well, I have the Old Testament. He has the New and Revised issue.
That's right.
Yeah.
I prefer Gutenberg, so we're all set.
Wait, was that Luther's Bible? I don't know. Anyway, the whole point is, it's a pharmacology book, not the real Bible, folks.
No.
So your job, Randy, is to ask questions, be entertaining. I know you said you wanted to get into podcasting, so here's your chance.
Oh, shucks. Great way to start. Thanks.
Mm-hmm. Look, if two old white guys can do this, you should have no problem.
Yeah. Setting the bar real low
wait.
here.
No. One old white guy. Ben's younger than I am. We're good.
Yeah. There's a gap there. What were we just talking about? Thiazides?
Diuretics.
We went over the HCTZ and what was the other one? Chlorthalidone.
Yep, chlorthalidone.
Mm-hmm.
Chlorthiazide is used occasionally. I see the suspension at work, the diuryl.
Yes. Okay. That's what I'm mixing up with chlorthalidone. It's a look-alike, sound-alike, as they say.
It is. All have sulfur. All have the same set of side effects.
Yep. One thing about thiazides, I guess, worth mentioning is, you have your electrolyte imbalances. But one thing, when you think about diuretics, is dumping electrolytes. Yep. They spare calcium, the thiazides do. It's what I'm seeing in the Bible here. I forgot about that one.
Yeah, so you could theoretically, in some patients, get hypercalcemia.
Yes. Yep, that's what it says.
But you're also going to dump a lot of electrolytes. You're going to dump potassium, magnesium, sodium.
Right, a lot of that. And I guess aside from losing those electrolytes, you get the dizziness, maybe a little bit of hypovolemia as far as side effects go, right?
Yep, hypovolemia. Where the sodium goes, the water goes, and the blood pressure goes down. That's the beautiful thing about diuretics.
I think that's pretty much it.
Yeah. Contraindications, of course, the sulfur, or any allergic to any of the excipients.
Yeah. You know what? We forgot to do the disclaimer, man.
Oh yeah, we're not
We keep forgetting.
Yes, the Two Druggists podcasts are two pharmacists that are informing you of things and edutaining.
Yes.
None of this should be taken as gospel and or medical advice, and we are not responsible for your idiocy. There we go.
Thank you.
You're welcome. It changes every show.
Yeah, but it's the same point, same take.
It is. We're not responsible for your idiocy. Speaking of idiocy, I have a great story from today. You missed it.
Okay. Yeah, been gone. What's going on?
A veterinarian called the pharmacy today.
Okay.
And ordered some bumetanide for their cat. Okay, fine, whatever. I don't know what the hell you use that for in a cat anyway. I don't know that they have irritable bowel, but whatever. Then they ordered test strips for the office, of course. But then the girl says, and my vet wanted me to call this in. I said, oh, what is it? A freestyle Libre. I said, what?
From a vet's office.
Yes.
Okay.
I said, who is this for? It's for the cat.
For the listeners that might not know, what's a freestyle Libre?
Oh, Freestyle Libre is the latest and greatest in, continuous glucose monitoring. It's made by Abbott. It's applied to the skin. You swipe the reader. It gives you a blood glucose reading. Eliminates finger sticks for, 95% human use.
So it's a needle you wear on your body.
Correct.
Okay.
And so she says, yeah, a Freestyle Libre and a sensor for Fido the cat. And I said, really? She said, oh, yeah. I said, okay. And whose cat is this? Oh, it's the vet's cat. Okay, fine. How are you going to pay for it? She goes, yeah, well, we kind of needed a price on it. I gave her the price. She went, oh. I said, yeah, that's not bad. I said, just give us a MasterCard. We'll charge it up. You just pick it up. It'll be fine.
Yeah, sure.
So my question is, who's gonna shave the cat to put on the sensor?
Well, there are how many ways to shave a cat? So
none that I know of that end in not getting bitten.
That's what gloves are for.
But there are ways to shave cats?
I mean, I guess so. I have a cat. I got a cat.
Have you shaved it?
No, but I also don't need to use a Freestyle Libre on it. So.
Well, do you want to try shaving it, and we'll videotape it for YouTube?
It's a hairless cat, is what it is. The only hairless cats can wear the Freestyle.
Yeah, just get a hairless one, and that solves all your problems.
Well, I figured you would just apply a piece of duct tape and rip it off.
That's the best way to get rid of your cat.
I'm not a fan of cats. I had my penance cats, and that's it.
Aww.
So yeah, this vet bought a Freestyle Libre, and I can't wait to hear how this turns out.
Yeah, I'm interested now too. You have to let me know what happens with that one.
That was
my guess for all the cat owners at home. If you put it on the back of the head, a little bit down, that's the one place they can't look at it.
Okay.
My guess is that's where it's going. Hopefully,
that makes sense.
That does make sense.
You'd have the best luck there, I'd guess.
I would like to watch the cat go around its house and flop into things to try to get the sensor off.
Yeah.
It'll probably do that.
And then the other thing that this whole thing brought up, this is a total digression into lunacy, but how do you get a finger stick out of a cat if you have to check their blood?
Very carefully.
Have you thought about that?
You get them on the ear is what you do. Just like you do a fingertip, you milk the end of the ear to get some blood, and that's where you lance them.
Oh.
Do you have a cat? They don't like you touching their ears.
You can't get them on the fingertips. That's the best bet. And I learned that just because one time I dealt with people ordering test strips for cats and dogs. It's a thing. You get them in the ear.
Well, it's funny you say that, because in research, if you need to draw blood for an animal, you use a rabbit. If you're using a rabbit, you use the ear because they have lovely large veins. But I don't know that I would go near a cat's ear.
I wouldn't.
Anyway, to be continued. It just amused me greatly that I sold a Freestyle Libre for a cat to a vet.
It's pretty good.
It was. I mean, it made my morning.
So we covered thiazides.
Yes. Well, actually, there's one other thiazide we should mention that's in the top 200.
Which one's that?
Well, it's usually combined with another fluid pill in kidney dysfunction. Randi probably knows what that is because she's brilliant.
Like maybe. I mean, I'm guessing it has hydrochlorothiazide in it.
No.
No, I don't know.
It's only used with another fluid pill, only for kidney problems.
Oh, okay.
Little old people get the big gun water pill A, and then they get this along with it to boost the effectiveness.
See, I was lost, but now I think I know where you're going with it. With this.
Does it have spironolactone in it?
Oh, but you're in the right vein. It's not a spironolactone. That's a potassium-sparing diuretic that we'll get to. That's a lovely drug. No, Lasix? This one. Well, yes, this goes with Lasix, but that's a loop diuretic. Starts with an M.
You're maxed out on Lasix. What do you add to potentiate the loop?
Yeah. Starts with an M, 6 letters. We'll start miming it out for you. It's a little purple pill. Comes in 2.5 and 5 milligrams.
I wish that narrowed it down.
Tell us, Matt.
It is metolazone or Xeroxolin.
Oh, yeah, there we go. That would have been my next guess. Yeah.
Yeah, so metolazone and Xeroxolin.
Yep.
2.5 and 5 milligrams.
I've seen it prescribed a couple different ways, like sometimes once weekly, like an hour or so before your Lasix or whatever. Sometimes people take it daily. I've seen also.
Yeah, I've seen that as well.
So I don't know that there's a standard as far as how it's dosed, but I've seen it a couple different ways.
I think it depends on your level of electrolyte depletion and your kidney function.
Yeah, because there is that warning too, I guess, that the excessive, dumping of electrolytes and hypovolemia, that sort of thing.
My desk reference here says that metolazone can be added when your creatinine clearance is below 30.
Okay, so that's safe. It can be used in under 30, you said?
Yes, because
gotcha.
It is reduced renal function. It'll work.
Gotcha.
That's the only thiazide. Wow, this show might lose us subscribers. Anyway.
We're
moving along.
The next class is the potassium sparing, it looks like, right?
Yes, it is.
There's a bunch of them.
Oh, wait.
Or maybe.
There's one clinical pearl we missed. I apologize.
Okay, go ahead.
Thiazides may decrease the clearance of lithium.
Ah, okay.
So
is it the thing where you have to kind of keep your salt intake or your sodium intake consistent with lithium? So yes. Thiazides, you lose salt, you lose your lithium, or however which way it works. Gotcha. Something to keep in mind.
Well, no, this says that if it decreases the clearance, it would build up. So you're losing other electrolytes. The body's holding on to the lithium.
Gotcha. So you get the lithium toxicity then.
Right. So you get the tremors, the other things that go with lithium.
Right. The drunken appearance that you would have. Right.
Yeah. Yeah. Now we can move on. Now we can move on to the...
Electrolytes can mess you up, man.
Yeah.
Which brings us to the potassium-sparing diuretics.
Yep.
Looks like there's less than what I thought. The main one, I guess, that I see at least working is spironolactone. Then you have the triamterene, which is paired with a thiazide, HCTZ, are the fast movers of the bunch.
My favorite that I always see come across that, is not often used is amelioride.
Yeah, you don't see a whole heck of a lot of that one.
Some of the older cardiologists use that.
They gravitate towards that one. I think we have it on the shelf where we work. I think we do.
It's white triangular pill.
Okay. A nice jagged pill to punish the patient.
5 milligrams, yep. And the nice thing about the potassium-sparing diuretics, you don't get the hypokalemia. You do retain some of those electrolytes.
Right. Hence the name. They're also referred to as aldosterone antagonists.
Yeah, I'm going to let you talk about aldosterone.
Well, that just goes down the pathway like the ACEs and the ARBs and the RAS system, as they call it.
Yes.
And somewhere, not in that pathway, but another action that they have, I guess, is an anti-androgen effect. So right.
No, so go ahead, please.
So your spironolactone, you get the feminization sort of effect. You get the man boobs.
Yep.
The reason why, it's not the type that you can get rid of with Peloton. All right, it's the type. It's an endocrine disorder.
It is.
And it's in that metabolic pathway where it blocks non-specifically androgen receptors. So that's what causes that feminization, the gynecomastia. People use it for hirsutism or women with excess hair or even men with excess hair, early onset puberty in men. But say you need a potassium sparing diuretic and you don't want boobs, you can get on a Clarinone.
Yep.
Inspra. And that one, it's a non-selective androgen antagonist. So you don't get that sort of effect, endocrine rise that you would get with spironolactone. Just an alternative if your patient can't tolerate those side effects.
So the real question is,
yes,
can women get that side effect? This is a loaded question, Ben. I already know
possibly.
the answer.
I think they get that side effect even before they start taking it. So that's my guess.
Well, women use it for acne, I've seen. Because acne can be caused by excess testosterone, so you're blocking that. So sometimes you see women, they will get spironolactone for that use.
Wow.
Yeah.
I learned something in this podcast.
It's got some uses, man.
Now, about a month ago, this woman came into the pharmacy. She's in her mid-60s, and she was asking about a Clarinone, and she wanted a cash price. She was a little agitated.
Is it expensive?
No, it was dirt cheap. It was like $40 for a 90-day supply. And they sent her down to consultation, and it was me and one of our other colleagues who was wrapped up in something.
Yeah.
You know the type.
Right.
So I go down there and talk to her about a Clarinone and tell her it's a good alternative. And I asked her what was going on, and she goes, "I'm having a very bad side effect from spironolactone."
Oh, no.
I said, care to elaborate? She goes, I really don't want to. Okay. So we talk a little more, and then she says, okay, I'm lopsided now. It's like, that would be a good reason to change. I'm sorry, that can happen. It's a side effect of the drug. I was very uncomfortable.
Yeah, sometimes you get those moments.
Yes, you do.
Luckily for you, you're a smooth talker, very professional, so I'm sure you handle it perfectly.
I did. I empathized and,
yes,
suggested that her doctor send in a Clarinone right away.
It's a good alternative to bypass that stuff, for sure.
I said, check back with your doctor in a few months to see if it resolves. For the love of God.
Does triamterene come on its own, or is it just like the MAC side with the HCTZ, the capsules?
I bet it did come on its own at one point, but I have only ever seen it in combination.
Yeah, same here.
Which tells me it's probably a sucky diuretic on its own.
Oh, here's a good thing to mention. I guess not so much potassium guys, but thiazide's sensitivity to the sun. So if you're out and about in the summertime, sunscreen.
So what you don't want to do is take your hydrochlorothiazide with your the Clarinone and your Bactrim.
Right.
or else you turn into a lobster.
And then get in a tanning bed.
Right. That would be a fantastic way to get a hell of a rash.
It would not be a good patient outcome, as they say.
No. Decidedly.
Right.
Speaking of rashes.
Yeah.
Did you hear about the guy that came in that had SJS?
They came into the store?
Yeah.
His skin was sloughing off like a zombie?
Not quite, but he was on his way.
And his first thought was to go to the pharmacy?
No. I was the stop after many other stops.
Gotcha.
Because he came in with his hands all bandaged up.
Oh, no.
The guy looked like a rapper from the 90s. You remember Vanilla Ice?
Yeah.
That was this guy's idol. He had the gold chain, the hat sideways, the blonde cut. I kid you not, this guy looked like he wanted to be Vanilla Ice.
But Vanilla Ice with SJS.
Correct.
Okay.
With bandaged hands, and he looked like he had a big problem.
So it wasn't like the Nelly Band-Aid. It was just like he was bandaged everywhere.
No, his hands were bandaged because that's where it starts, and it hadn't spread yet.
Right.
And he comes up to the counter and he says, "I need something, a cream for my hands." I just kind of look at him and think, I'm not so sure about that.
Poor fella. That's a killer reaction to have.
It is. And I said, well, what happened to start this whole thing? He said, I tried to start a fire with gasoline.
Wait, what?
Gasoline.
So what?
He burned his
So he
hand.
burned himself. He didn't have a reaction.
Himself. No, he did. That's where this gets really strange.
Okay.
So he burned himself. He went to the hospital. They gave him doxycycline for 2 weeks and bandaged his hands. Okay?
Could you imagine?
Wait. So the guy is on the doxy.
Right.
He's also on Lamictal.
Jesus. He's on like every one.
Yeah. And so I'm talking to the guy and I'm like, is it dress? Is it SJS? Either way, this is bad. So I said, go ahead.
Sorry, was his face involved or was it
Not
like,
yet.
does that mainly, okay.
It was just the area on his hands, and it was like starting to go up his arm, and it looked like he had been hit by like some sort of, it was erupting. It was really
gosh.
awesome. Yeah, it was a Friday night, by the way. It was great.
But that didn't.
That's one way to describe it. Great.
No, it was. This is stuff that you only see in clinical pharmacology, and there it was standing in front of me.
That's crazy. I've never seen someone with that type of rash.
Neither did I to that point.
I've had one guy, he was on doxycycline, and he came into the pharmacy begging for some help with his hands because someone had told him to wear sunscreen with it. And they went to the beach because, of course, they're always going to the beach when they start doxycycline. And he forgot to put sunscreen on his hands, and it was like lobster claws and then normal. And it was, you could see where he stopped with the sunscreen. It was
wow, just on the hands were super red?
Nice.
Like starting to pee. And it was so red. It was like the color of your logo on your shirt, just like fire truck red. Oh,
just on the hands. That's got to be killer.
Going to the bathroom would be very difficult. Were his hands swollen up, or were they just red?
Just picture the worst case scenario.
Man, blisters. That's terrible.
Killer sunburn. Doxy, man.
It's great for you. But we were talking about sun sensitivity and going back to the diuretics.
Right, and which I guess segues us to the other class, which I think has the same issue. I think. The loops have sun sensitivity?
I believe they do. At least Lasix does.
Can anybody talk about the loops?
Sure. The loop diuretics are the diuretics that work in the loop of Henle.
It's easy to remember.
And they dump pretty much everything out of the kidneys.
Yeah.
Sodium, potassium, other electrolytes, magnesium, and water right along with it. Of course, we're not going to use these for blood pressure. They are our big guns for diuresis in heart failure.
Right.
So recall your New York classification of heart failure. You won't be quizzed on it here. Just keep that in the back of your mind. And of course, we use this for symptom control in heart failure, and that is to restore euvolemia, or to pull off fluid in a big way.
Yes, good word. Euvolemia. We're thrown on hypovolemia.
Yeah, well,
which is, as you could probably surmise, is low volume. U is normal, right?
That's right. Now, if you over diurese them, they become a potato chip and they become hypovolemic.
Yeah, never good.
Never good. You want to keep them right in that steady state in the furosemide, Demodex or torsemide, and bumetanide or UMES are your three loop diuretics, the big guns.
The big boys.
Yes. If you ever see a prescription for that, you have big problems.
I guess it could be used for other things too, just like pulling off fluid from anything, whether it's like the lungs or people with pneumonia, things like that. They're great for pulling fluid out of the body. Symptom control.
And the nice thing is, it goes back to that whole theory of the body as compartments. You have the vascular compartment, the tissue, the organs. You pull water out of the vasculature, water from the tissues, and repopulates it.
Redistributes.
Yeah, that's a great word.
So you should eat a banana with these, right?
Or that really lovely horse pill of 20 MEq of potassium.
There we
depending on your labs.
Monitoring parameters.
That's right. You're going to definitely want to monitor your potassium, your sodium, your magnesium. If you're doing it for heart failure, you're going to want to make sure your patient's getting daily weights. The scale is important. 1 to 2 pounds a day fluctuation could be an issue. 5 pounds a week, I believe, is the other metric they go by.
I believe you're right. Yeah.
Oh, I got a nod from our pharmacy student who's probably more up on this than I am.
Oh, for sure. Definitely more than me, too.
Oh, yeah. She went through cardio.
Okay.
Didn't you guys go through your cardio module recently?
The first year of it, yes. We haven't gotten to apparently the hard stuff yet, but I feel confident.
No, you'll be good. So it's coming up in the therapeutics part.
That's right.
Okay. Yeah, you'll be fine.
The other thing is, if you over diurese somebody, they're going to be dizzy, nauseous, unsteady of gait.
Right.
They're going to have effects from that.
Some maybe confusion or altered mental static. Gout exacerbations is another big thing.
Yeah. I have to look up the mechanism of why diuresis potentiates gout. The only thing I could think of is you're dropping the water volume and still have a high uric acid level.
Right. I think that's it.
It increases the concentration.
Okay.
Yeah.
See, that's why we need a student on here to clarify these things that are foggy.
Yeah. See, now Sajjad had a whole list of questions he was going to ask.
Okay.
Well, where is he?
He's a slacker and he's studying for his exam. Unlike
I know, I should be, but I mean, this is still learning. So
it is. What's your exam on tomorrow?
Pharmacy management and pharmacoeconomics.
Oh, you have my rotation. You should be an expert at that.
I feel very confident going in. I say that and then watch. I'm gonna have to. I won't do well.
Your exam's tomorrow?
Yes.
Okay. Good luck. I'm sure it'll be fine.
Oh, shucks. Thanks.
Hey, 85s get Pharm Ds.
Yeah, that's exactly right.
B's get degrees.
That was my motto, and hey, I'm working on being a social
completely
media
adequate. Yeah.
Oh, there are even some days I'm excellent. Just depends on the question.
Yeah.
Looks like we're forgetting one loop. I forgot about this one. This is Matt. You might know how old this one. Edecrine, the ethocrinic acid.
Yeah, that was from the days of JC.
That's Old Testament stuff.
Yes. No, I think that was one of the first ones.
Yeah. I think we have that on the shelf at work. I think we got that one too.
Not only do we have that one, we have at least one lady that's the only one she can take.
Yes. Yep. Intolerance to the others, whether it's, I guess, sulfa or excipients or whatever.
I think it's more excipients than anything else.
Gotcha.
Funny story about that individual. She also is intolerant to all ARBs except Diovan brand.
Yeah, we mentioned that on the last one.
That's right, we did.
The brand name, but it's covered, and the copay is not astronomical either.
No.
It's not like it goes right through. So what the heck? We keep
And for
it.
the pharmacy economics, it's a positive number, so we'll take it.
Yeah, if it's above 0 in today's world, we'll take it.
Assuming there's not a DIR fee or clawback on the end of it.
All right, the things we don't see when they're picking up phone calls and whatnot.
No. But, for your pharmacoeconomics exam, I'm sure those will be topics of interest for you.
Probably. Yeah.
Did they even talk about those in school?
They mentioned it.
So what did they tell you?
It wasn't emphasized, but...
So what did they tell you about pharmacoeconomics in school?
I mean, not much, no. I'm kidding.
Wow, we've got that on all of that.
Yeah. It was, you're asking me the day before the exam, and now it's all just kind of coming together in a big mush.
It's all stored in your brain, and it's hard to spit it out because. But to be honest, I can't remember what we learned. You kind of just pick it up on the fly when you start working, I guess.
No. We had Dr. J.
That's right.
And he had the slide
cool.
deck. He had the slide deck from I think the previous professor. And it was very theoretical is the best word I can come up with.
Randy, when you guys are doing your virtual lectures, do they still do the turning point, like the questionnaire to make sure everybody's like in attendance and like paying attention?
We've had a couple of professors do it, but no, not typically.
Okay.
At least not in this class specifically.
Okay.
We see a lot more in the clinical classes, like when we're dealing with medications and things, because I don't know why, but yeah.
So how many slides are there?
Like at least 100.
A good amount of slides.
That is.
Yeah.
And was there any supplemental reading?
Probably, but I did not to my knowledge, but there probably was.
Okay.
I'm really painting myself to be an excellent student, aren't I?
Well, you show good smarts. The night before the exam, you're on our podcast instead of studying, so that clearly gets you points in our book.
I mean, at least shows competence. Whether or not it's warranted is a completely other matter, but...
Well, it's only, 75 questions?
Yeah, about.
So here's a question about diuretics for you, Randy.
Okay.
What drugs should you avoid when putting someone on a diuretic? It's a class of drugs that are over the counter. It pretty much takes up one whole side of the cough and cold aisle.
Avoid with diuretics.
Yeah, they can technically potentiate fluid retention. COX-2 inhibitor type drugs.
Like NSAIDs?
Yes.
There we go.
NSAIDs.
Okay.
That's it.
Just like the ACEs and ARBs, they're problematic together. Yep.
And the other thing out there is, in some instances, the loop diuretics can cause ototoxicity.
Yep. More with the Edecrine, though.
Yeah.
So if you want to avoid the sulfa allergy, go with Edecrine. If you want to avoid the ototox or the tinnitus and vertigo, do not use Edecrine.
And of course, a direct contraindication to any diuretic is anuria, or no urine production.
Yes, hold the diuretic, hold the dose.
Although at that point, they're probably on dialysis.
Yeah. Furosemide, I don't know if we went through all the names. Furosemide's Lasix.
Yep.
What else is there? There's bumetanide, which is Bumex.
Yep, we don't see that very often.
Not a whole lot. And then there's torsemide, which is the Demodex, all of which are the loops. And we said Edecrine. So there's your brand generics.
Yep. And we've talked about the mechanism, some side effects.
Yep.
Yep.
The Lasix you see as a liquid, an oral solution.
You
So
do.
pediatric, a lot of vets call it in too.
Yeah. I love veterinary prescriptions for Lasix.
Mm-hmm. We can flavor it chicken. It's all good.
Yep. That is that the oil or is that the liquid?
What's
or
that?
Is the Lasix oil based or do you use regular?
No, the Lasix is water too. You have to. You can just put the chicken oil flavor in there and just shake it real good, or add a little bit of polysorbate or something to make it go in. But it works. We do it.
Good stuff.
Yeah, man. Help out our critters.
My favorite prescriptions are veterinary prescriptions.
Oh yeah, because people pay for them.
That's right. We love your pets more than you do.
Yes.
We'll help them. Any strange request, Dr. Ben's got you covered.
Somewhat. I'll try.
Well, you have many references.
Oh yeah. There's some books from the 90s back there.
One of the ones that fascinates me is Plum's Veterinary Pharmacology Manual.
I haven't flipped through that a whole lot, but it is a cool book.
It is written by a PharmD, actually.
Really?
Yep.
Cool.
Let's see. People should remember about diuretics. We talked about the hypokalemia, the hypomagnesia, hyponatremia, hypocalcemia, hyperuricemia, elevated lipids, elevated triglycerides, dizziness. We talked about the rash. In some rare cases, alkalosis.
Oh wow.
Yeah.
Is that like toxic or can that happen at a therapeutic dose?
I would assume it would happen at a therapeutic dose.
Gotcha.
Let's see. Diuretics may exacerbate conditions such as diabetes, gout, systemic lupus erythematosus. I can never say that. SLE.
Yeah.
And of course, chronic kidney disease.
Yeah. Excessive diuresis can cause acute kidney injuries.
Yes, it can. When you reduce the blood volume to the kidneys, they don't like it. They like a certain pressure.
Yep. And that goes for avoiding your alcohol and caffeine also, which are also diuretics.
Yep. Definitely. It's funny. Students should remember or note that most of the over-the-counter diet pills, like Diurex, are caffeine and herbal blends.
I think there's caffeine tablets, yeah, like you said.
Yeah.
So they'll keep you awake.
Yep. Actually, there's a great YouTube video by a physician about a guy that drank 2 gallons of coffee cramming for an exam.
2 gallons of it?
2 gallons.
Just get a monster drink already. I mean,
he managed to shut down his kidneys. He coded 5 times and damn near died. So easy on the caffeine.
Oh, yeah. Moderation.
When we post this on YouTube, I'll put a link in the doobly-doo down below to that video.
Yeah.
Yeah.
I think we got them all.
I think we did. And
I want to apologize to the listeners for the hiatus.
Oh, yeah.
The 2 druggists sometimes have some shit going on. Right?
That's right.
Did you get a new fence?
No, damn it. I did not get a new fence.
Not yet.
Not yet. I have to move the current GD fence.
Okay. I knew you were in the works somewhere.
For the listeners, when we bought our house, there was a fence installed on the property. They're clearing the lot next to us, and the surveyors came through and magically denoted with their stakes that my fence is in the other lot. Yeah.
So step 1 now is getting rid of the fence?
No, actually step 1 was call my title company and find out if there's a survey done.
Okay.
Because if they miss that, technically it could be covered under title insurance, and they might have to.
Okay. Well, on the bright side, weren't you talking about wanting a new fence?
Yeah, the missus did not go for that idea.
Okay.
No, that's a non-starter.
Sorry, man.
It's okay. It's painful. Home ownership is
It's
almost
something.
almost as bad as student loans.
Yeah.
Yeah, so almost the same thing, basically.
Yeah,
Fence versus
Oh, yeah.
thousands of dollars. Yeah.
yeah.
Always a job to do.
Well, you had some house issues recently with your AC, right?
Yeah, I had a unit go up, but it was like 15 years old or something like that. So didn't owe us anything, but I had to take care of that and some other stuff.
Yeah,
Home ownership, man.
it's a form of indentured servitude to the bank.
Yes. Every month when I sign my name paying back the bank, I cringe. Just like towards the student loans.
Yeah, we should start the campaign to get student loans forgiven.
Yes, well, that's the point of the podcast. You guys need to support us, listeners.
Yeah, we still don't have the Patreon page up, but it's coming.
Yeah, we'll get there.
It's in the needing stages.
Yep. Once we get some traction on the two druggists,
that's right.
We'll be getting there.
You can catch us on Twitter at Two Druggists, and Instagram at Two Druggists.
Yep. Unfortunately, we were taking off on TikTok, but that got canceled.
It did.
So
the president canceled TikTok, and Chloe had to go back on.
So our millions of TikTok followers, you can transition over. You can come over to us on Instagram and Twitter, and you're getting the same content minus the dances.
That's right. Your dances were doing better than my dances, I'm sure.
Yeah, well, it was a group effort. We were really taking off on TikTok.
It was a separate group effort.
Yes. All right. Well, I hope everyone learned something tonight.
Yes. And we're at about our expiration date for this episode.
Yeah, that's good. What are we going to do next? Flu shots you mentioned? Maybe possibly.
I think we're going to do a special episode as a primer for flu shots. Hi.
Hey.
Say hi to everybody on the podcast.
Hi.
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 Are you going to bed?
Yeah.
Good night.
You just missed a lot.
Dora the Explorer movie? I don't think I missed that, sweetheart.
No, you missed a lot of it.
It's okay. I will see it another day.
That crazy old lady was actually a goner.
That's wow. Okay. Bye.
You gotta catch up on Dora, man.
The live action Dora movie, they were watching that downstairs. It was crazy.
Have you seen it?
I saw about 15 minutes of it and said, "Oh shit, it's time to do a podcast."
It's creepy.
That's my first reaction when I watched Dora the Explorer.
Well, no. Everybody who was a kid or has kids has watched the cartoon Dora, right?
Yeah.
Talking to her backpack and talking to the map and swipe or no swiping, right?
Yeah.
Well, this is a live action. This chick's talking to her backpack and acting like she needs lithium.
You have to worry when the backpack starts talking back, That's my first sign that I'm overworked.
In the film, it did.
Yeah.
We should wrap this up. Ben, you want to wrap it up for us?
This has been the Two Druggists podcast with a special guest today, Randy. I hope everyone learned something and you weren't bored. And again, we're here to edutain you. So if you eat a banana with your loop or you don't eat a banana with your loop, you didn't learn it from us, consult your physician or pharmacist professionally.
Agreed. Good night, everybody.
And, yes, over and out.
Good night. Thanks for having me.
You're welcome. Bye.